You've probably heard it said that the eyes are the window to the soul. Well, how are those eyes impacted as we go through menopause? Mine have definitely been impacted. I can feel the dryness. You probably notice how much I blink. Now you're going to look at the YouTube video and see how much I blink, but I have suffered definitely from dry eye. I want to ask my guest all about that today as we talk about our eye health. Today, I welcome Dr. Meenal Agarwal, and she's the host of the Top 3 Medicine podcast, Uncover Your Eyes. She's also a leading voice in eye health and longevity and has been featured in Times, Forbes, and Fox News. Let's welcome my special guest, Dr. Meenal. So, you're in menopause, maybe you're perimenopause, and you've noticed some changes to your eye health. Well, one thing that I've noticed is that I suddenly had to get glasses. I know that happens with age, but another thing that has been really stressful for me and that I've noticed is a dry eye. So we go through these changes in menopause. I'm so happy that you're here to chat with us all about the shifts that we're going to see. Welcome to the podcast.
Thank you so much for having me.
So why? What is happening with the eyes? I want to dive right into the dry eye because again, this is
Yeah.
something that I've been suffering with and yeah, we want solutions. So why the dry eye in menopause?
Absolutely. So, I mean, during menopause, perimenopause, we have these shifts in our estrogen, progesterone levels, and they obviously are these hormonal shifts that can really directly impact our tear producing glands. And so we are not getting good quality or enough tears. So it's the quantity and it's the quality of our tears. And so a lot of people will notice symptoms like watery eyes. People will come in and say, "Hey, my eyes are watering. I'm not dry." But that's actually a symptom of dry eyes because
Oh,
the quality of tears is so watery. It's not actually, it's like having sticky lotion versus watery lotion. Watery lotion won't do anything. So we need the oils also to come out of the glands to stick those tears onto our eyes. So it's two parts to it. So supplementing yourself with tears is great, but that's a band-aid solution.
mhm.
And for women, I'm going to say, we have to work on balancing our hormones and trying to our best because I always say the eyes are the window to the body. So if we are, balancing ourselves, concentrating ourselves systemically, you will notice a good shift in good quality tear production. But there's also great supplements like omega-3s can really help. I tell all my perimenopause, menopause women to
Mhm.
start omega-3s. It's great for the rest of your body as well. But the three is actually what's important for the eyes. So not the 369, but the threes is what you really want for the eyes and a good quality one, right? We have the really cheap ones for, $50 for, 180 capsules versus the, 80 to $100 ones. It's in the way it's produced and manufactured and the bioavailability of the omega-3 that's important and for it to target your eye glands. But omega-3s, artificial tears, hot compresses with a moist heat mask really helps daily. We brush every morning, every night, and we floss. And we've been taught this since we were little, but we are never taught to take care of our eyes until bang, we hit, 35,
Yeah.
40, and we have all these things happen. So I think as eye care professionals now, we are really starting to advocate preventative care and teaching even younger patients, using eye masks before they sleep and helping getting good quality tears come out. So the eye mask, the moist heat masks actually help to melt any blockages in our meibomian glands, which are the glands that produce oil for our tears. Those get blocked over time with makeup,
Mm.
debris in the air, everything, right? Our concealer, a lot of us want to kind of cover our under eye circles and it goes up. So you want to get good quality tears. You need those oils flowing. So your heat mask is your best friend. And by heat mask, I don't mean like a cloth that warm in the microwave. I mean those legit moist heat masks that you can buy, usually eye doctors, or you can find some on Amazon, but they should be moist and they help to unblock those glands. I'm going to say those are my top three things to kind of help with your dry eyes. But systemically, you want to balance your hormones because that's one of the biggest culprits.
Yeah. Uh, I have one of those masks, and they are like the little beads, right? And you can put it in the microwave. Do you put it in the microwave for about 10 seconds, I think I was told, or that I read on there?
Yes.
Not
Yeah.
longer. You don't want to burn anything. And then yeah, and then you place it on your eyes for 5 to 10 minutes, something like that. It's
Yeah.
funny, after you use that and you take it off, your eyes kind of look milky a little bit, but I'm guessing that is some of the oils, like you were saying, from the tear ducts spreading through the eyes.
Absolutely. So we say we like to put it on at nighttime. And it's
Yeah.
also good, you hear all these theories about heat mask, people using it in the airplanes and stuff just to help relax and calm, your body down, your eyes down. So it's kind of nice to use at night before you sleep as well, I think.
I had one of these sleep masks because I do sleep with one, not the heated one, but a regular mask just to block out any light. And this one was a weighted one. And I fell asleep with it on. And in the middle of the night, I woke up and my eyes were just killing, like the pressure. And I thought, okay, I'm never doing that again. Are there certain masks that we should avoid? Was this
Yes.
something that I did wrong, or is that not a mask that we should have?
So I don't love weighted masks,
Yeah.
especially if they're going to be on your eyes, all night. One of the kind of bean masks, the moisture heat that you're talking about that you've used for dry eyes is great because you're only going to use it for 10 minutes. So
Yeah.
even though there is a bit of a weight to it, it's not too long. I also don't love eye masks that have massaging capabilities in them. Um, obviously your eyes or the delicate tissue around the eyes, this is the thinnest tissue, compared to the rest of our body. So we don't want to mess with it. And also our eyeballs, where our cornea is, the front of the eyes, eventually, if you're massaging it constantly, you can thin your cornea, which actually leads us to a condition called keratoconus, which is not reversible. So by the same token, we recommend to kids not to eye rub, especially with their knuckles. Eye rubbing can thin your cornea. Even though your eyes are closed and you're rubbing your eyes, it's thinning your cornea, or excessive amounts of it will thin your cornea. And I feel eye masks, especially the ones that are massaging, have that similar capability. So I don't love the idea. I don't feel like your eyes need to be massaged. If you want to keep it more towards your temples, your head, that's great. But cutting out light is great for migraines, for your circadian rhythm, like the whole thing. So one of those silk light masks just to block out the light, because that's the only purpose of it, or that's what you're using it for, would be the best option, I think.
I think a lot of us experience symptoms, and so many of us, we just ignore them, right? Like with my dry eyes, I had been one to just go, well, I can suffer with it. It's fine. I'll use the tears intermittently. I find it tedious to do the eye mask, so I'll do it when I feel like it. What happens if we ignore a symptom like that? Could it lead to anything more detrimental?
Yeah, I mean, I want to say specifically dry eyes will just get drier, and eventually it leads to symptoms that are not as reversible as we like them to be. These symptoms include persistent redness, where I want to say you almost look like you're high all the time. And patients will come in and say, this is what I look like. People at work think I'm high, and get my redness out. And it's like, we can't do that. It doesn't work like that. We're at a point now where your glands are completely blocked. I like to tell women that, it's like you have the pink eyeliner sign. So if you look really close, you'll see where our eye, where we would put eyeliner on our lower lid margin, it looks pinkish or reddish. And that's because blood vessels have started to think that that's an injured, or your body has started to think that's an injured area, and starts to have blood vessels creep up there to give more oxygen and start healing it, almost like an inflammatory process.
Hmm.
So it appears very reddish or pinkish. At these types of points, I mean, there are treatments. I'm not going to say there's not, but it's much more harder. But then we go into more invasive treatments like radio frequency or intense pulse light, where we are trying to melt the glands, and we're also trying to decrease the inflammation. And there's obviously immunosuppressant drops as well that we can use to suppress that inflammatory response. But I'm going to say a big part of it is cosmetics, and then how you feel. You're burning all day, you're stinging all day. It affects your lifestyle. There are studies out that people are depressed because of their eyes. They have, suicidal thoughts because they want to just rip their eyeballs out. And I think that we've come to a point where we are on devices all day. Plus, we have hormonal shifts. Plus, we have environmental changes that are making us drier. We are only going to get drier as a society. And if we don't start taking that proactive approach, we're going to be screwed. And, for lack of a better word, but with the eyes, we're so reactive. We only go to the eye doctor when there's a problem.
Yeah.
We're not proactive, right? And I always say with dental conditions, skin conditions, you know, they're obvious. They're more obvious. You either see it or you feel it. But with eye conditions, a lot of times we don't feel it or see it until it's almost middle stage. And we really should be proactive rather than reactive with the eyes.
Yes. Well, that is the JFK quote that I use all the time. The time to fix the roof is when the sun is shining, right? So fixing the eyes while the sun is shining, while they're not at, a 10 out of 10 in pain or having inflammatory impact, that's the time to take a look. Now, actually, I heard you on your Instagram talk about eyeliner tattoo. You just said eyeliner and it just triggered me to recognize that I don't think you approve. So let's talk about.
I got a lot of backlash for that
Oh,
one.
did you? Okay. Love that. Let's talk about maybe what some of the harmful impacts of having eyeliner tattoo on. If you did get it, because a lot of people did in the 80s, a lot of women my age have it. Is there anything you can do now if you have it?
So, because of my backlash, I'm going to try to be politically correct here that it's really important to have a skilled technician do it because you are tattooing an area where you have so many meibomian glands, which again are those key oil producing glands. And the tattoo has to kind of go around each meibomian gland. You can't just go straight in a line. Otherwise, you are literally tattooing on top of your meibomian glands. So you need a really skilled technician, number one. You need very sterile conditions. You are risking massive styes or chalazions, infections inside those meibomian glands, which can be painful. So skilled technician and sterile environments are my top two if you're going to do it. Then I always say it's mindset. You want to make sure that you want this for life or many years, because the removal process can take many lasering treatments to remove it, just like any tattoo. But again, you're going around your delicate glands and you're putting yourself at risk again. So those are the three things that you want to make sure before you get it done. I understand it's a self-esteem booster for some women and it's important. So if you want to go ahead, go ahead. But my main concerns are the meibomian glands, and my second concern is the eyes have the most delicate, thinnest skin over your whole body, that area. So you just want to be careful that you're confident that you're lasering the thinnest skin on your entire body.
I'm glad you said that about just the safety aspect and the cleanliness. We had Dr. Julie Simers on the podcast talking about hospital safety and just what happens within the hospitals when people don't wash their hands. And you could go into some places, like a lot of people do this type of treatment in their home. I'm thinking about eyelashes as well, eyelash extensions. Is it a sterile environment, right? And how those infections and different things could set in. And again, thanks for highlighting the fact that it is the thinnest skin on our whole body, and it is super susceptible to anything like that. Have you seen some nasty little infections from eyeliner and eyelashes?
Yes, and it's funny because I've seen quite a few from everything. I think it's the eyelashes. I want to so for the eyeliner specifically, lots of chalazions or styes, which are
Lori, can you tell us what
infections.
a chalazion is? I haven't never heard of that.
Yeah, so think of it as a sty that's just been there for a long time and no longer can be treated with, more natural therapies and eventually has to be removed or excised.
Oh,
So it gets kind of hard. So I like to use them interchangeably, but for your audience sake, we'll call them styes. But those are infections that are inside the meibomian glands, and those are very common with eyeliner tattoos because again, you're going right in that area. And with eyelash extensions, that's a whole nother department there. I mean, we're seeing the 12, 13-year olds. I mean, I think she was 12 the other day, and I looked at her under our slit lamp, which is our magnifier, and there was Demodex, which are these mites crawling all over her
Come
lashes.
on.
And I looked at mom and I felt like throwing up. I don't think
Yeah.
I've ever seen so many.
Oh my
But
God.
being an eye doctor and the one treating her, I really couldn't do that. But I looked at mom and like she could tell, like my jaw dropped. I was like, you need to rip those things off right now. And the problem with it, again, is the maintenance, right? These 12, 13, 14-year olds are they think it looks nice. So they're not going to understand the hygiene purpose of it. Like, we got to still clean them. We got to maintain them. We got to wash them in the shower. We can't just leave them. And so the daughter said to me, oh, yeah, I don't wash them. I just keep putting mascara on top of it every morning to kind of get rid of the white crustiness and stuff. And I'm like, oh, my God. And this has been on for like 4 weeks. So, I think, again, it's the hygiene, the sterile sort of environment, but also I want people to know when you are targeting your natural lashes, you are actually weakening the follicles, right? Especially with the extensions, you're weakening, putting that weight on with your natural lashes. And eventually we are going to see an increase in loss of permanent lashes. We haven't seen it yet because this is the wave where it's all happening in the younger demographic. But these 14-year-olds, when they're 40, they're going to come to us and say, I don't have any lashes.
Mm.
What can you do to grow it? And I see a few patients that are in their 50s and 60s that tell me that. But I think that age bar is going to come down because of this eyelash extension craze. So I always just say stick to a great mascara if you can.
Yeah, I think you're right. It's so interesting as we see things come in clumps. A big people group will start to do something, and I know it's my daughter's age, in the 20 something that are doing this, and even teens. You're saying, and 10, 20 years from now, we're going to notice the impacts of that practice. Is this something that you would never do? Like
I have
those little
never had one. I have
no,
never had an eyelash extension. I have never had an, eyeliner tattoo. But again, they weren't common, growing
yeah,
up for us. And I like now that I'm an eye doctor, I don't think I would at all. Um, but again, like I'm not opposed to it. And I
yeah,
tell all those Instagram followers that it's okay, but you have to remember that most people are not doing it in these sterile environments with skilled professionals. Most people are cheaping out to the cheapest option and just getting it done. Their friends are doing it for each other.
yeah.
Um, as long as you're hygienic about it and you understand how to clean your lashes, how to treat your fake lashes, that's what I want people to do. And a lot of times with the extensions, they start halfway through your natural lash, so we will see the mites crawling right at the beginning of your natural lash before it gets into extension, and it's gross. It really is.
That is gross. I trained an ophthalmologist once when I was a personal trainer going into homes. And so we'd chat. And I asked him, I'm like, what's the grossest story that you've ever had? And he said, a woman who was a gardener, he had seen a worm behind her eye when looking in his microscope or whatever he looked through. I'm like, that is so gross. But I guess that can happen, can't it?
Not yet for me. Not
You
yet for
you
me.
haven't
Thank
seen
God.
that? Yeah. I know that would be like, oh, I don't know how you, as the person with the worm, would live through the night. I don't know. That would just make
Yeah.
my skin crawl.
Yeah.
So some of these things, people my age, we're not probably going out to get the eyeliner tattoo or put the eyelashes off on, but we are on our screens a lot. Like let's just talk about some of best eye health practices when it comes to screens, because I am all day long computer, phone, lights, and of course I want to protect my eyes and do the best thing for them. So what are some best practices when it comes to our eye health and screen time?
Yes, absolutely. And with screens, there's a few things. So, the first thing is the staring all the time at a screen, which causes the dryness. The second thing would be the blue light coming off screens. So there's a couple of components. So with the dryness, I'm going to say advise your children and ourselves to take frequent breaks. We call it the 20-20-20 rule, where
Okay.
every 20 minutes you look 20 feet away for about 20 seconds, to give yourself a break, because looking
Okay.
far away actually, you're going to blink and you're going to move your eyes far away. But also there's another good thing about that rule is our rate of nearsightedness is increasing in our demographic. By the year 2050, 50% of the world will be nearsighted because of all the near work we're doing. So it's counterintuitive, but the more near work you do, the more you develop a distance prescription.
Hmm.
So by doing those breaks every 20 minutes and looking far away, you're actually relaxing your muscles such that we can slow down that myopia or nearsightedness onset. So I'm going to say for the dryness and for the myopia, you want to take breaks. And obviously you can supplement with artificial tears to see if that helps with your dryness. Um, and then the blue light aspect to it. You know, I'm not 100% sold on the blue light filter glasses, but if you're already getting glasses and you need them during presbyopia when you're 40 plus and we're all into reading glasses, you might as well add that filter coating on. So what that does, it helps to filter out some of the harmful blue light in the visible wavelength that comes from these screens. Now, we are not sure, but studies are being conducted on how harmful this blue light is. We do think that it is it is affecting our mitochondrial cells, causing oxidative stress on our retina, therefore possibly going to increase the rate of eye diseases like macular degeneration. But what we do know, so those are being studied. We think that is happening, but we don't know. But what we do know is the blue light is affecting our circadian rhythm, our sleep pattern. It is not helping us sleep as good as we should. So my rule of thumb is if you can 2 hours before bed, drop the devices, because you are not going to be sleeping well, which again causes all these health issues. As you know, we need good sleep and proper sleep. And it's kind of like cutting out all the light while we sleep. But then if 2 hours before bed, you're going to sit on a device with blue light coming out at you, that's not great. So, try a pair of blue light filter glasses. The other thing is the blue light that comes from our screens actually scatters. It's a scattered light. So it causes more glare and just reflections for our eyes. It's actually harder for our eyes to interpret things. So it causes more eye strain. So it's anecdotal, but I'll have patients that wear blue light glasses and say, oh my God, all my eye strain is gone. We don't know if that's true, but we do know that blue light is scattered and can cause eye strain, possibly because your eyes have to focus more. And then there's the factor of screens are constantly flickering, right? That's how they're saving power. They're constantly. So when you're looking at me right now and I'm not flickering, but I am flickering, I'm just flickering at a super high rate, like crazy, such that I look like I'm on all the time. But phones are designed to do that to save battery. So can you imagine you're staring at that screen that's actually flickering all day? That's adding to eye strain. So again, a lot of issues with screens, but to summarize it for kids, for adults, it's taking breaks, possibly adding a blue light filter coating, adding artificial tears if you can, and getting off those devices about 2 hours, if you can, or even 1 hour before bed is very important. And then mindset wise, I always like to tell myself, you'll hear these mindfulness speakers that when you get up in the morning, the first thing we all do is reach for our phones, right? That also cognitively kind of sets the tone for the rest of the day. So trying to keep off for the first half an hour, at least if you can, will also help you, in terms of wellness.
Can we just go back to the little formula? It was 20 minutes, you look away 20 feet for 20 seconds, right?
You
Is that
got
right?
it.
Yeah.
Yes,
Okay,
you've
that's
got
a
it.
great tip. Everyone can do that. You can put a little push notification on your phone just to remind you. Have a little sticky note on your computer just to take that little break. I like that. I didn't even think to sort of set that refocus, right? And go from that near vision to something that's far away. I like that. It's kind of like how you would focus a binocular. They just kind of refocus it
Yeah.
into something else. That's a great tip. So, why are the eyes the window into our overall health? I heard something on Instagram the other day. I should have written down the name of the doctor. I can't remember now, but in essence, he said that when you lose some of your senses, your propensity to develop things like dementia or Alzheimer's could be greater and faster. Basically, because if you lose your hearing and you don't supplement with a hearing aid, or you get a cataract and you don't get them fixed, you lose that ability to use that sense, and then of course that can impact our brain health. Can you speak to that?
Absolutely. So the idea is about 50% of our brain process, 50% of our brain space is actually used towards visual pathways. And that's a crazy
Wow.
amount. So
Yeah.
50% of our brain is used towards processing visual pathways. So I mean, those into kind of neuro health, they'll understand this, that there's the dorsal pathway, the ventral pathway, the visual cortex. 50% of those pathways are processing what you're seeing visually. And that's a lot of amount. Like that's just crazy to me when I read that stat initially. So when you have lost some vision, or you have visual impairments, or even total blindness, your brain is working at a more significant or harder rate than it should be. Kind of like if you have heart disease and your heart has to pump more. So it is working harder. And therefore, we are seeing a rise in these cognitive neurodegenerative diseases, because your brain is declining faster. It's being used up. It's straining itself to compensate visually, when the other 50% should be used for all other functions like cognitive and everything else. So we are seeing an increase in, Alzheimer's, Parkinson's, other neuro diseases like MS, dementia. Like, there's a high rate of everything, because again, 50% is your brain is visual. When you look at somebody, it's another crazy stat, but when you actually look at somebody, 80% of that perception is visual. Or you look at somebody or something, 80% of that
Wow.
perception is visual.
Mm.
So I'm just going to kind of give you a little kind of segue into understanding that. For example, if you're dating somebody and you look at this person, if you think about it, 80% of the perception of this person is visual.
Mm.
And then we wonder why attraction is so important. I
Mm.
truly believe because of that,
Mhm.
because 80% of what we're processing is visual on the person. So we have to be attracted to them. It's biological. It's nothing we can change about ourselves. So these are all surprising stats. With certain diseases like Alzheimer's, Parkinson's, we are able to detect it in the eyes sometimes earlier than, you going for a scan. And a lot of times we're able to detect it before the cognitive decline shows.
Hmm.
So sometimes patients will have things like, for example, for Parkinson's, they'll have the Parkinson's stare, we like to call it, or they'll have issues with tracking their eyes, moving their eyes, eye movement as their muscles are starting to weaken. And then for both diseases like Alzheimer's, Parkinson's, there's also a certain protein buildup that shows up in the brain that actually shows up in the retina as well. So yeah, we're getting to those times where we're able to, I don't know if we're confidently able to say it, but we're able to say, hey, something is wrong, you need to go get these scans done to confirm it's in your brain as well. So again, your brain is so much, there's such a big dedication to the eyes or the visual pathways, that it is truly the window to the body.
Mm. So we see a lot of obesity and metabolic disease, diabetes in our culture nowadays. What do the eyes tell on that story?
So the eyes have one of the highest supply of blood in your entire body, actually. So we have a lot of blood vessels in our eyes. We have a lot of mitochondrial cells. I know they're little tiny eyeballs, but we have a lot of those. And the eye is the only place where we can actually see your blood vessels and see your nerve. There's no other place in the body where you can just look and see your blood vessels and see your nerve, right? So it's one of the only places where we can detect something that's not symptomatic. So if somebody doesn't know they're diabetic or doesn't know they have high blood pressure, like countless times we are the people that, tell the patient that, hey, your blood vessels are showing patterns that show that, you could have high blood pressure, or hey, you're showing bleeding in your retina, your blood vessels are leaky, showing swelling, whatever the situation is, you need to get tested for diabetes. So we are the first people to, say that cholesterol plaques, risks of plaque strokes, all of this. I've sent so many 40-year-olds to the hospital because I see a plaque in the eye and I say, oh my God, this is a heart attack or something, stroke waiting to happen. You need to go to the hospital today. And most of the time we're right, because if we see a plaque, it's going to go somewhere after the eyes. And that's the fear. We don't actually almost care about the eyes. We're like, it's there already. But what we care about is it's going somewhere else. And these are not plaques where it's blocked the patient's vision and they can't see anything. These are routine eye exams,
Right.
plaques in the branches, of the blood vessels. And the patient's actually asymptomatic. And it was funny, I had a 40-something-year-old the other day, and she said to me, I just had my physical last month. I'm completely fine. And I'm like, no, no, no. You need to go to the hospital like right now. Like,
Wow.
I need to tell you, you need to go now. She ended up going. They kept her there for 2 days. They did like entire workups, like heart, everything, because we have to remember our physicals nowadays are very much catered to what the doctor and you think you might have. But sometimes we may not get what we think we might have, right?
Right.
And, you may not fit that typical stereotype. I had a emerge family doctor who was skinny, fit. He rides his bicycle to our office. Like he's, very athletic, everything. And, I said to him, and he's an emerge doctor. I said, when was the last time you had your blood work? And he was, it's been a while. And I go, can you please just have your blood work today? You're going to the hospital, ask the nurse to take your blood work. He calls me the next morning. His sugars were through the roof. He was immediately put on insulin.
Wow.
So, I always say diseases don't come with a textbook body type, right? It could be in any of us.
Well, that is the due diligence that we must do. And I think so often we put that off, don't we? Either we're afraid of the results, and so we just don't want to, or we feel okay today. But we feel okay today, and then tomorrow you have diabetes. That's when you're diagnosed. It's like one day you don't, or you're obviously increasing and on the precipice, but the diagnosis is not one day, and then the next day you do. And that again is why our due diligence and fixing the roof while the sun is shining, I think is so, so important. How do you manage that for yourself? You're a busy entrepreneur, running a practice, having a YouTube channel. How do you prioritize your own health and wellness?
I'm going to say I didn't until I hit rock bottom. And I think
Mm.
most of us, I mean, sometimes that's what it takes.
Yeah.
It takes trauma, hitting rock bottom, and until one day I actually had my entire lower back was inflamed and I couldn't move and I couldn't function. I was off work for a couple months. And that's when it hit me that I need to be there for my kids. I need to learn to balance and not just focus on work all the time, but learn to balance it. So, I have made a couple of changes in my life, or significant changes, I should say, where like I have learned to prioritize what matters in the now. So
Mhm.
everything can wait till tomorrow, but what matters today is I just need to get these three things done, rather than trying to get everything done on one day. But also certain things that matter to me, everybody's priorities are different. Like for me, what matters to me is seeing my kids when they run through that door after school. I don't care if I start early at work, but I want to be there when they come home and, have dinner ready for them. And so I have a hard stop at a certain time so that I'm there for them. And I try my best, not to shift that hard stop no matter what for anybody. Doesn't matter what opportunity I get or what happens, because we can keep chasing our dreams, but at the end of the day, if there's no one to share them with, what's the point? So I think it was a rude awakening, but it happens to a lot of us. And then we learn to shift into that wellness department, take care of ourselves. I wasn't having my physicals. I was borderline sugars as well. I had no idea. but then taking that time out to, see a dietitian, see a nutritionist, and getting that resolved, monitoring my sugars. So if we can be proactive with everything, we'll not get to that point where half our time is dedicated to taking care of our health. So, I know the younger generation is very good at that. I want to say their wellness, their well-being, a lot of them are not working as much. They're, want a 4-day work week, that type of thing. My time was not like that. We were working 7 days a week and we just in the grind, right? Like we learned from our parent generation. But the shift should be wellness, well-being. We're seeing a lot of mental health issues, even in the eye space. You'd be shocked. I mean, the rate of depression is 2 times higher if you have a visual impairment. The rate of anxiety is 2 to 3 times higher if you have a visual impairment. And that's not blindness, just any impairment. And the rate of suicidal thoughts is 3 times higher. And it's because losing your vision is debilitating, and you lose your independence. When we restrict those 80-plus-year-olds license, you should see how mad they are, and it's because they're losing independence, right? So take care of your eyes, your body, and I'm thankful for people like you who have such a great tagline, for your podcast, for your Instagram, where it's all about just wellness and moving. And so if you can take care of your body, you are taking care of your eyes.
Great, wise words to end with. All right, folks. Fixing the roof while the sun is shining has never been more important than it is right now. And I've given this analogy a number of times, but your health truly is that glass ball. There's other balls in your life, like the PTA, like your job, like some other commitments that are rubber balls and they can bounce if they're dropped. But your health is one that if it's dropped, it's curtains. It's so crucial to think about your health as being that glass ball and to put yourself on the list. And I think at the top of the list, because as Dr. Meenal said, what can you do who can you take care of if you're not around? Right. So focusing on that. Thank you so much for joining us today. That was so insightful. I took away a lot of things. I'm definitely doing the 20-20-20. I'll never get eyelashes. I've never had them, but boy, have I contemplated how much easier it would be and how much better it would look on the podcast. But yeah, I'll stay away from that probably. Doing the preventative stuff like that. I'm going to bring back my heated eye mask out to get all those oils circulating in my eyes. And of course, having that proactive approach, seeing your optometrist on a regular basis and making sure that you keep up with those appointments. And then, of course, eating, moving, and focusing on well-being is so important as well. Where can people listen to more of your content and where can they follow and find you?
Absolutely. You can follow me on social media. My social media is at dr.meenalagarwal. So that's my full name. And then you can also listen to my podcast on any podcast platform. It's called Uncover Your Eyes. So you can find me, you can DM me any questions about the eyes or your health. Of course, feel free to.
Wonderful. And I'll link all of those in the show notes below. So you don't have to memorize that, but take a look in the show notes to follow Dr. Meenal. Thank you so much for joining, everyone. As always, go move daily in your fitness, wellness, and nutrition. And we'll see you all in the next Move Daily Talks.